Can you see that screen?
Yes. Yes. So meeting. I should probably close that stuff then. Okay. All right.
All right. If you could take a look at that and let me know when you're done.
Oh, once weekly. Ooh. Okay.
Okay.
Yeah.
So what struck you? What did you, any observations? What did you like? What did you dislike? Any questions?
I told you, the once a week is kind of cool for the kids, right? I don't know if it's IV. I didn't pay attention to that. Is that
It's an oral pediatric friendly.
Oh, yeah, doses already once weekly. So, that's the first, when it comes to chronic disease, quality of life, and then you're sort of saying, there's no, in the grade 3, grade 4, who's, acceptable. And then sort of saying like you don't, paradoxical effect and not expected. Okay. So, then, because it's upstream of the MEC, I suppose, it sort of reminds me of the story of sorafenib before. So you're saying there's no paradoxical effect. Yeah, those are the sort of, and then the other thing I would say though is, I don't know what you think about the way of assessing. It's a discussion on, do you use RANO, do you use RECIST criteria, how easily it is to do a volumetric analysis by MRI on the real life, but that's for a study. But I don't know if it's actually part of your question. If you ask me the profile of the drug, like the first thing that stood up is the PO once weekly.
Okay. And so if the efficacy was otherwise relatively similar to everything else, that's really what would discriminate and differentiate this product versus others.
It could be. I mean, 26 cycle is a month cycle, or is that how many months?
Yeah, I'm sorry. Great question. No, it'd be once weekly, 28-day cycles.
Okay, so then the other thing is that it's actually a longer treatment than what we've seen in the past, right? So because there's a sense that you should probably treat those kids for a longer time. That's also sort of interesting.
Okay. So the MEK and other BRAF inhibitor trials have been shorter?
Yeah. I don't know. I can't remember. I don't know for the selumetinib whether it was selumetinib was 12 or 18, and then the tram is 18.
Okay.
18 cycle, yes.
18 cycle. Okay. Anything on here that you dislike?
No, in fact, in the dosing things like the fact that kids could continue if there was benefit, sort of interesting. I don't have the toxicity data, right? So I don't know what kind of a profile in terms of toxicity that drug has, right? So, is that cardiac? Is that skin? Is that because the MEK is sort of interesting, but it has its own toxicity profile that you have to get used to, and then can weigh in the balance of impacting quality of life sometimes. So.
And what is that? What you mentioned the MEK inhibitors have their own toxicity profile. What does that involve?
Skin toxicity.
Got it.
It could be a bit of a burden for parents. The cardiac toxicity we haven't seen, but in principle could. So again, first do no harm.